Thank you all for joining on a Saturday evening, Saturday morning US time. It's a pleasure to introduce Dr. Sangeeta Sharma. For about 10 years, I know her. To introduce, she has done her BA/MS from BRKR Government College, Hyderabad. I was very specific to tell her alma mater, so I wrote it. MD and PhD from National Institute of Ayurveda, which is very famous. All of us know that. She has done both MD and PhD in Panchakarma. And currently, she is working in Maharishi International University. She's a director in the Department of Ayurveda and International Medicine. The great thing about her is she's very compassionate towards her patient. She specializes in metabolic and lifestyle disorders. She is very particular. Her patients just don't take medicines. They have to practice yoga also. And we have seen benefits of that. As I told, she is specialized in Panchakarma. She has written a book on Vamana. She is a member in a journal based in US. I mentioned about Vaishnavi Trust. Right from day one almost, she has been guiding all our protocol, guiding our children, guiding our pregnant women. And she is very excited in sharing her knowledge about Ayurveda. The best part, I will summarize it this way, is she can explain Ayurveda in such a simple terms. With, I would say, less of Sanskrit, not zero yet, but no less of Sanskrit so that common man can understand. But even if the Sanskrit comes, like we'll start with the first question, which will answer, she will in Sanskrit, but she will quickly catch up with English, and so that, we get the meaning. Otherwise, people generally switch off when we go to Sanskrit. But I'm very happy that, she will be able to communicate in such a simple word so that common man understand. Thank you, Sangeeta Sharma, to join this session.
Thank you so much, sir, for such an elaborate introduction of mine. I'm so much blessed. And as Mohan sir said, that I'm so blessed to be connected to Vaishnavi Trust and, help them in their journey. I just want to make a little correction. I work as an associate professor here in Maharishi International University, and I'm director for clinical training program for the master's program. Thank you.
Thank you. So we will talk about Panchakarma, but just we are expecting few more friends who are like me, who like Ayurveda, but they may not know Ayurveda. So we'll start with a very basic definition of, unless we start with Vata Pitta Kapha, we don't think we are in Ayurveda. So we'll start with that, ma'am, if it's okay.
So first we want to understand actually what is Ayurveda. So in simple terms, understanding the word meaning of Ayurveda is Ayu means life and Veda means wisdom or knowledge. So it's like knowing the life or knowledge of life or way of living is Ayurveda. And what is the prayojana or purpose of Ayurveda? So it's so beautifully explained as an optimistic way that Ayurveda aims in maintaining the health of a healthy individual and also treating the diseased. So we aim at or focus at maintaining the health of a healthy individual. And if someone falls sick, we have to treat them. So we also treat the diseases in Ayurveda. So that is the basic definition of Ayurveda. You want me to continue, answer?
Yeah, yes, please.
And so basic understanding is like I hope many of here in this call knows what is Ayurveda, but at least a basic understanding is we will just start with understanding Vata Pitta Kaphas, and I'll just give 1 or 2 minutes information about okay, these are the biohumors or physiological entities with which we understand the physiology of the body. So Vata means it governs the complete movements of the body, neurological functioning of the body. Pitta means the metabolism, all the enzymes, hormones, the functioning. And Kapha indicates the structural component of the body. and your joint lubrication, your strength, your immunity is represented by kapha. So these three physiological entities, vata, pitta, kapha, represents the physiology of the body.
Thank you. We always take pride in saying Ayurveda is comprehensive, complete, it's body and mind, and we try to, as I said, quote the sloka samadhatu. So probably we should start with that because that is such a comprehensive, well-being definition. I won't even say health definition. So we might want to start with that.
Acharya Sushruta gives the definition of swastha. Swastha means being in one own or establishing in one own self. And then he says samadosha samagni samadhatu malakriya prasanna atma indriya manaha swasthaitya vidiyate. So here he is trying to say that an individual who is having balanced doshas, who is having balanced Agni, the digestive metabolism, who is having balanced tissues, and whose elimination is proper. Along with that, a step more ahead about mental well being, that a person is in complete bliss, having or happy, and having the blissed senses, mind, and Atma, even to that level. So, perfect health is not just merely absence of disease, but it is physical well being, mental well being, spiritual well-being and social well-being. So it's a entire in its entirety. It is a holistic definition of health.
Thank you. Uh, we'll jump into our topic today. I know why is so powerful, or Panchakarma is so unique to Ayurveda. We get excellent benefits, and I keep telling people, preventive. I mean, we buy a car, we buy a AMC, we buy everything, we buy AMC, right? But for our own bodies, how much of preventive health efforts we have taken is a question, and I feel Panchakarma fits into it very well. There are problems, go understand, or even before the problems become aggravated. Panchakarma can help is what we hear, but we want to hear from you. Where does Panchakarma fit in Ayurveda?
Wonderful question, Mohan sir. So in Ayurveda, Panchakarma is an integral part, and the word itself says Pancha means five, and Karma means actions or procedures. So these are five biopurificatory procedures through which we try to remove the underlying toxins from the body. So when I'm saying five procedures, these are the five major procedures which are represented in Panchakarma. Along with that, we do have external procedures starting from little Abhyanga, just the Abhyanga, to all the modalities of Panchakarma. So what does Panchakarma do? So Panchakarma helps in establishing the physiology, balance in the physiology, bringing the homeostasis in the physiology. It rejuvenates the system, and it also prepares the body that suppose if someone is suffering from a disease and we are trying to first set the platform to remove the toxins from the body, and then when we give the medication it reaches to the target very efficiently because all these channels are completely cleaned and opened. So Panchakarma is promotive, it is preventive, and it is curative. So on all the three platforms Panchakarma is helpful.
Thank you. Probably I'll take a minute to tell how did I land up in Ayurveda. I was having a respiratory issue, and I was told, I was diagnosed for sleep apnea, and happily I bought a CPAP machine which gave excellent sleep quality, but still climbing up staircase was difficult, and no respiratory issues were there. And pulmonologist said yes, and then we used that puff, what they call. It was giving little benefit, but I'm also a Vipassana meditator. Maybe I will skip it for the another call. Vipassana, as we say, or of course, every tradition says that some good karma of the past. I was introduced to a great Vaidya called PLT Girija at Adayar, and she said, Mohan, you throw the CPAP machine, you don't need it. And she did Vamanam about 11 years back, and after that, I have not used CPAP machine in my life. And I've been very fortunate. Otherwise, I would have traveled with CPAP machine all these 11 years, and it's so convenient. And I am definitely not having this thing. So when I asked the doctor, this seems to be scientific. What is the best way to give back to the society? We have seen cancer, diabetes, and I know autism, this is what we come across daily. She said, no, malnourishment is the curse of India. 50 to 60% of Indian women and children are malnourished. So, your effort should go towards malnourishment. Happy to report about 1,000 children today in Tamil Nadu and 1,000 pregnant women in the tribal area called Kalvarayan Hills. It's a district combining both Salem and Kallakurichi in central Tamil Nadu are getting benefits where the hemoglobin levels are going up. We are still using the government protocol. We are executing this protocol in the government PHC. So very, very satisfied to report. Maybe I get another opportunity to talk about that. So that is why I came to Panchakarma, and recently 2 weeks back I did my Vamanam again. I'm so excited just to share the benefits. So I leave it to the experts to know what is Vamanam, and please help us understand why it is such a miracle.
Before we start about going deep into Vamana Karma, I would wish to share few more, insights about what overall Panchakarma can do to an individual. So when I said it is promotive, preventive, and curative, why I'm emphasizing on this point is now Ayurveda is on the forefront. Millions of people are getting benefited out of Ayurveda throughout the world. And when it comes specially to Panchakarma, I want to tell to the audience through this platform that Panchakarma is not just something like someone steps in and says, hey, I want to do Panchakarma, and the Vaidya will write it. Being a Panchakarma specialist, I hold up that responsibility that it is a unique procedure. And it's like my teacher, my mentor, Dr. Bhatt had always said that Panchakarma is surgery without incision. So we are diving deep into the physiology of an individual, and we are trying to correct from the base level. So we need to look into the client's do's and don'ts, what actually the client's body is, for physiologies, and is the client fit for that particular procedure or not, and then it is planned accordingly. And when I'm saying it is wonderful promotive and preventive aspect, and this is here where we are bringing in the wellness aspect, that an individual, as Mohan sir just said, that we buy so many things in our life and we take care of them, and when it comes to body it is even more important to prepare it. So preventive aspect of Panchakarma is amazing. You want to prepare your body, or you want to rejuvenate it, or you want to keep going, and the anti-aging process, or keep yourself healthy. There are different modalities in Panchakarma, and even the Shodhana aspect, what we are going to discuss now, helps a lot. So in Ayurveda, Charaka talks about daily routine, and in that also he has mentioned many Panchakarma aspects. He talks about seasonal routine, like, okay, once the season changes, you need to do certain do's and don'ts. In that also, he mentions very detailedly about seasonal Panchakarma. It's like, okay, it's a spring, why don't you go for Vamana? Because your kapha is at an increased high, high at that pace that it has to be eliminated from the body. If it is spring, if it's fall, we should plan for Virechana, or whatever modality is fit for the individual that has been planned. So this is a preventive and promotive aspect of Pancharma. When it comes to curative, it's even more vast, more spreaded out. In the Western population, because I'm here in US, working here since 4 years, I've tried to understand that the wellness aspect of Ayurveda is more prevalent rather than the treatment aspect, and it's developing. The awareness is coming, but Panchakarma is very, very, very efficient in treating many complicated diseases. And now we'll dive deep into Vamanam, as Mohan sir was saying. I just want
Before
to
we go to Vamanam, you may just want to say a few lines about each of these five, and that could be useful.
So five major purificatory procedures are Vamana, means therapeutic emesis, Virechana means therapeutic purgation. Then we do Nasya, Arine therapy, we do Bastis, that is internal enemas. Either it can be decoction enemas or oil enemas, and it's a wide range. Basti is called as, Ardha Chikitsa, or even the complete treatment. There are many, 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 many diseases which can be, treated by Basti. And even also the preventive and promotive aspect is also handled with Basti. And then the last one is Rakta Mokshana, which is bloodletting procedures. through different ways. It can be leech therapy, it can be cupping, it can be incision. There are many other ways of doing the Rakta Mokshana or the bloodletting procedures. These are the 5 major Panchakarma modalities. We call them at biopurificatory procedures because here we are working at the level of purification of the biology or the physiology at the deeper level, at the cellular level. We are removing out the toxins at different levels. Mainly Vamana and Virechana, the Shodhana procedures are emphasized. I would add one, as Mohan sir said that, oh, Sangeeta shifts from Sanskrit to English very fast, but I would definitely take this opportunity to tell about the benefits of Shodhana, what we are going to discuss, the Panchakarma. And Charaka very beautifully says in one shloka, and I would wish to recite it. And he says, Evam Vishuddha Koshtasya Vyadhischupashamyanti Prakritischa Nivartante. And he even goes ahead and he says, it gives, it takes care of your indriyas, means the senses. It rejuvenates the complete system. And then he says, Jara Kruchena Labhate Chiranjivatya Anamaya. Even says the aging process will be delayed. You'll be more in your normal age, or you will be young for longer period. And he says Chiranjivatya Anamaya. So you live for longer life without diseases. Anamaya. So, and even he says balam, pushti, tushti, and he says vrushata. So all the parameters of health are being taken care of if one goes for Shodhana or one goes for Panchakarma as a preventive modality, as a promotive modality, or even as a curative modality. Thank you, Mohan sir.
Thank you. So there are questions coming up. So we will maybe 10-15 minutes, we'll talk about Vamanam, and then we will take questions one by one. So every subject is huge. I don't think we can do justice. So let's take Vamanam and dive deeper, because as I said, I personally got much of benefit from Vamanam, and I really wish many more people, because what I understand, there is an age limit, right? You can't go at 70 years and say, please do Vamanam, or as you said, doctors will decide whether you are fit to do a Vamanam. So who are the typical customers in our language, for Vamanam?
So when it comes to Shodhana, and especially when it comes to Vamana Karma, I would say those people who are suffering with kapha disorders, mainly with kapha disorders, those also who needs deep purification, or in common man's language, deep cleanse, diseases, metabolic diseases, like we can do Vamanam for obesity, we can do Vamanam for diabetes, we can do Vamanam for all the skin issues, many major of the skin issues, and kapha related issues, respiratory issues, chronic sinusitis, migraines, asthma, cough, any kind of congestions, even excess salivation, bad breath. These are few to mention. Even wherever there is deep cleanse is needed in the system, we start with Vamanam and then we do the Virechana. So the complete purification is done.
Is this the upper body part probably also you can mention?
Yeah. So all the upper parts, because kapha, we are mentioning kapha is the seat for the upper portion of the body. So all the ailments related to the upper portion of the
How does Vamana, what actually happens in Vamana? I mean, we can probably talk about, because whenever many people want to do Vamanam, but my favorite question in the world of working from home, and people do multiple things. Even if many people are interested, they get a little bit worried about, oh, I have to take 1 month off, 2-3 weeks off. How would you address that question?
As we are discussing that, it is we are trying to bring the body to the balance, the physiology to the balance. Definitely an individual should give some time and space for that. So when a person comes to us and says, hey, I'm going through these issues, and can you please help me out? So if that particular individual is fit for Vamana Karma, we have to prepare the body. And as you said, how much duration is needed. So it also depends from person to person. If suppose a person has come to me and there's lots of ama in the system, so there's lots of toxins, and the digestive fire, what we call in Ayurveda, Agni, is not at that particular stage where we can even start the process of Shodhana. So the first, like when we are preparing a person for a surgery, suppose if someone is going for surgery, there is pre-operative procedures, right? We need to prepare the body for that major part. So for preparing for that major part, this pre-operative or the preparatory phase is very, very important. And here we do Agni Deepana, kindling of the Agni through certain herbs. We give strict diet plan, do's and don'ts, like, hey, don't eat this, don't do this, certain things. When we take the deep history of the client, we come across certain things which the client is doing since many days, and then we have to stop it. So the major portion, I always tell my clients that my job is just to tell you, implementing it's on your part, and how much you implement, you get that much results. So in the preparatory phase, we prepare the body, so we kindle the Agni, we work on the ama levels, and we then, once the body is ready, like, okay, Vaidya will assess certain parameters that, okay, now your system is ready to go for the major procedure. So I would say at least 10 to 15 days, or at least 10 days, a client should give to, especially if you are going through this purificatory procedure, take that break of 10 days. So we'll start with internal oleation. We'll give some medicated ghee or medicated oil to the client in an increasing dose for 3 to 7 days, depending upon at what level the satiety comes or the body is ready. So in that phase, maybe 1 or 2 days or 3 days, client can work from home, because we are just giving some internal ghee to start the process. And in that phase, the person can work from home, not over exertion, not traveling, not exposing to the cold winds, even mental exertion. Also to that level, one can balance it, not high level stress. Then from after that 5 to 7 days, uh, the real phase comes where we do the body abhyanga for 1 day, and we do the swedana, the hot fermentation or the sudation. On the day of Vamana, also the Abhyanga and Svedana is done, the external massage and the sudation is done, and then we give certain herbal formulation with which we are actually triggering the process of vomiting. And Mohan sir has undergone through that, and he knows how, one has to prepare mentally and physically to go to that process. And that's why I'm again giving this caution that it's not like everyone doesn't fit into the box. They come to the Vaidya decides what Panchakarma procedure I should do for you in this particular problem for your, or if you are coming for prevention or rejuvenation aspect, how to prepare your body for that big day. And then we give certain herbs, the procedure happens. So I would say technically at least 10 days we should give to our body, that I need to prepare my body, I need to go through that process. And then the post, like after the surgery, we don't tell the client to, hey, you can join your job today. No, right? We need to prepare the body for that healing process. So even in Vamanam also, the day of Vamana, the client's body we have come to that stage where we have removed the toxins from the system. Now the body needs some time to come to that normalcy. It's like it's in a phase where it needs utmost care. Especially we need to take rest. You should not indulge in any kind of hyperactivities. And the diet should be well maintained. We'll start with some liquid diet, then some semi-solid diet, then solid diet. So at least 5 to 7 days of the diet protocol will be there that the client should follow strictly, because whatever he has done, the hard work to cleanse or to take out the toxins, that also depends upon this post procedure, that okay, how I have to enter into again the normal diet or the normal lifestyle. So overall, I will say that at least 10 days of complete involvement is important. And then we can go ahead with more questions, and we can,
Yeah. So one of the things Dr. Sangeeta said in my earlier conversation is, yes, 20 days today, if tell someone that you have to take off, no, which is kind of a challenging thing. But for the benefit it comes, and if health is important to you. But from my personal experience also, I would say that it's not 20 days you are off your work. Maybe 3 4 days you are off your work, maybe remaining 15 16 days you are definitely part-time. But my favorite quote, I mean, it's my own quote, but I say that if you follow 60% Ayurveda rules, you get 60% benefit. But if you follow 100% Ayurveda rules, you get 300% benefit. So if you are really wanting full benefits, you have to give your best. And she was humble enough to say, I don't know whether Charaka has mentioned it. The doctor's job is 5%, the patient's job is 95%. So if you do a good job, we get the best results. Is that right?
Yes, yes.
So, okay, now you said the preparation, these are the problems. What actually happens? How does the change happens, through Vamana?
So, see, if you want to understand in scientific terms, there's so many hypotheses or so many theories were played down or put down, and they have also done many researches. I would definitely encourage our audience to, enter into the internet and see what are papers are published, the mode of action of Vamana Karma. I would just give a brief information about it. What happens is when we are starting the body to give certain medicated oil or ghee, it is a lipid. And most of the every cell of our body is a bilipid layer, it's phospholipid. So many of the toxins are lipid soluble in the body. So when we are giving a lipid or any fat to the body in an increasing dose, this particular fat enters to every cell, and whatever toxins are there, they get dissolved in it. And once it enter, comes to the level of complete supersaturation, because we are increasing the dose every day, those toxins which are dissolved, they come out into the external extracellular fluid in the interstitial spaces. And then we prepare the body in that way that we are doing external abhyanga on 1 or 2 days, where we are also uh, taking out or improving the lymphatic circulation. We are bringing out all these toxins from periphery to the gut and preparing the for that one big day. So on the Vamana day, when we are giving the herb or the Vamaka drug, what I'm talking about, the herb which is inducing the Vamana, it triggers the mucosal lining of the gut. So, in understanding in terms of modern medicine, we say if body receives any trigger, there is a acute phase of inflammation sets in. Like body has to, it's like, oh, something is happening, let me control it. So body starts acting in that way. So the mucosal lining, the permeability increases, the capillary circulation increases, and all these toxins, they enter into the gut. And through the action of that Vamaka drug, whatever herb is been given, and of course the client is made to drink certain solutions, milk is given, certain herbal decoctions are given to drink. So in that way, the vomiting center is activated, and all these toxins are flushed out of the system through the oral route. And it's a process. It's not something which I'm explaining it is as simple as,
Yeah,
but
yeah.
at the level of physiology, at the level of biochemistry, at the level of neurology, certain actions are happening, and in that way, that sets in.
Thank you so much. So, I mean, I would say for a common man's understanding, all your toxins from the upper part of the body is accumulated in one place, and it comes out, right? Now, uh,
So
so
not even
yes,
the upper part, the toxins from throughout the
to
system,
the
from
body.
the
Okay.
periphery, throughout the system.
From the periphery throughout the system. Now, as a personal experience, I can say, yes, you feel lighter, you feel better. But I mean, medically, if someone has to say, you say, someone having diabetes, it helps, someone is having kapha issue. So if you were to list down the benefits, 5 10 benefits of Vamanam, what are the benefits you would say,
As I'm
possible with
talking
Vamanam?
that, suppose if a healthy individual comes to me and says, hey, for the preventive aspect, I don't want to land up into any kind of issues further in my life. I want to go through Panchakarma procedures. So seasonal Panchakarma is something which we, suggest here also in Maharishi University. We have an integrative health center here, and we suggest seasonal Panchakarma to our clients. And we have a unique community here. People, even beyond 75, 80, they don't have any metabolic issues because they were doing it all their life. So what we are doing is we are preparing the system, and as I said that when it comes to preventive aspect, we are removing the underlying toxins, the metabolic toxins which we are accumulating in the system, and if we are removing them seasonally in a due course of time, the Shroto Shodhana happens, the channels get opened up, and the rejuvenation happens. When it comes to disease, in this present era, it is more easy to explain because now modern medicine is, telling it that everything starts with underlying inflammation. There is chronic underlying inflammation which happens in the system due course of time, and that leads to all these metabolic issues, autoimmune diseases, whatever we name. So when we are doing the biopurification procedure, we are actually working on management of that, or taking care of that underlying inflammation, or taking out the toxins, the deep-seated toxins, the free radicals from the system. So that works at the core level, and that helps the client to heal better.
So I'm saying, what are the diseases typically? I see
So as we
some
mentioned
of
that
us
we
want to look at science. Some of us want to say, tell me what all I'll benefit. Will it help with diabetes? So list down the
So it
diseases.
will help in, like, as I mentioned, that Vamana will help with all the kapha related issues, as we mentioned. So you, like the upper respiratory tract issues or migraines or chronic sinusitis, or as I said, even as simple as bad breath or congestive issues. Then I said obesity, diabetes, major skin issues. All these can be dealt with, Vamana.
Thank you. Uh, I mean, it's in a world where instant coffee and instant noodles, right? Yeah, you told me I will go through this for 20 days. So will I see the benefit on 21st day, or how long I need to wait to see the benefit?
It's a wonderful question. So even Acharya says, when we tell them that follow these do's and don'ts, and there's a phrase, he says dviparihara kala. So he says, okay, I have given you certain do's and don'ts instructions throughout the phase of the process. Follow them, double the duration. So if suppose we have undergone through this process, it took 15, 20 days, follow it, double the duration. And you will start seeing the benefits. Of course, on the day of Vamana itself, the body will be as light as feather. There will be so much of lightness in the system. All the, channels get open up. There will be wonderful sleep. Appetite increases. So as the metabolic functions improve, you will start seeing the benefits. But you can observe the benefits at least after 1 week or 2 weeks. Overall, your physiology starts functioning in that way. It's like, you take your car to the service center. So when you're doing the service, are you driving it? No, you cannot drive. It's in the service center. It's getting serviced. Once it comes out, now it is our turn. They're like, okay, all my body channels are cleaned. I am a perfect individual now. Everything is so light. I'm feeling so good. The clients come to me and they say, you know what, Vaidya, what I'm feeling? I'm floating in the air. I'm having that much lightness in my system. My weight has reduced. I feel more energetic. Here in our community, our meditators say, I'm having wonderful experiences in my meditation. My mental clarity has improved. So all these things happen because the metabolism is improving, right? So all these can be observed slowly in due course of time.
Thank you so much. Uh, we'll probably take few questions. Of course, outside of India, we don't, allow Panchakarma to happen. So, which are the Panchakarma allowed outside India? Why Vamanam is not allowed? I understand one question is why FDA is not allowed Vamanam.
Yeah, I'm not a legal person to kind of answer this on this platform, but what I have understood after coming to US, see, overall, Ayurveda is not a legalized medical system in US. So we practice under a medical doctor's guidance. or the licensed practice of a medical doctor. When it comes to specially about Vamana Karma, uh, they I what I understood is because it's a process where we are, doing a reversing of physiology. Vomiting is not something naturally everyone does, right? Or it's not something which is done. So we are working on the system where we are triggering the system for that particular phase of time, and we are removing out the toxins. I don't know why there is a reason for that. Maybe if people like us go ahead and kind of talk about it, it may get opened up. But overall, also, um, still, we are on that phase where we are trying to create that awareness more and more, so that at one
Yeah,
point,
over the years, I mean, my example is ashwagandha, which we use in our Vaishnavi Trust protocol. The best photograph I saw in Costco during COVID times, like, stacks of ashwagandha being used. And now I mean, we use not ashwagandha, we use ashwagandhadi, which is ashwagandha and few other herbs. So a day will come, I'm sure Vamanam will also be permitted. But other things like Virechanam are all approved in US and UK, I understand, correct?
approved means, again,
Yeah,
I
you
don't
can.
use this word approved, but we do all the
Okay,
panchakarmas under the guidance of a medical doctor.
thank you. Is it a good season to do Vamanam, not so good season to do Vamanam?
So when it comes to a disease aspect, a client is coming to me with a problem, then we don't look into the seasonal aspect, because already the doshas in that particular person or the toxins are at that peak level that we need to remove them from the system. A healthy individual comes to me, maybe we definitely plan to do seasonal panchakarma. So in the spring season, uh, kapha is at its verge. It's ready to come out of the body. So it is good to do Vamana Karma in spring. So in the month of March and April, it
Yeah,
will be.
thank you. Any other questions? Team, feel free to ping now. There are a few other chat windows popping up. So if any question is missed, you can put it in the general chat window.
And as I said, like as you said, Mohan said that I've seen stacks of ashwagandha in Costco, right? So there's always, and even when it comes to Panchakarma, on the name of Panchakarma, everything is, being sold in the market. And being a Panchakarma specialist, I feel very sad that doing people just doing external massages and say we are doing Panchakarma. Panchakarma is a science, and it's a deep science, and there are many, many things which can be, treated with Panchakarma. So I I suggest to all those who are listening on this platform that reach out to the experts, reach out to the Vaidyas, reach out to those who are qualified in this field, and try to go and talk with them that what is needed for your system, which for your physiology. Get well educated and don't get carried away with whatever says Panchakarma is Panchakarma.
Yeah. So at this point, probably I will quote Dr. Girija when I use the word massage. She says, she doesn't approve that word massage. She says it's a treatment.
It's
So Abhyangam is the treatment. It's not massage, right? Massage has many other meanings. So we restrict it to treatment. Um, Location specific, I know Bangalore has many people, whichever platform you are through the Now Ayurveda group or Sangeeta, you can ask. And, there are many, many places in Bangalore, we can help you with about Bangalore Panchakarma. Can Vamanam help? I would not say mental disorders. So take mind as a space. Which part of mind issues Vamana can help, and which part of mind issues Vamana cannot make a difference.
So even Charaka Samhita, Acharya talks about management of psychological issues. He mentions Shodhana. Shodhana means again biopurification. It's Vamana, Virechana, Basti, all the procedures. And he clearly indicates that Shodhana helps in management of psychological issues. So Again, what I'm talking is we are trying to work at the core level. So now people understand gut brain axis. This is a very common word, which is becoming common. Like, hey, all our emotions, all our whatever we are experiencing is not just at the level of brain, but most of our serotonin is produced in the gut.
From what I understand from doctors, correct me if I'm wrong, doctorate, pregnant women have pitta dominance, and hence there are many challenges, morning sickness, etc. This pacifies the pitta, and hence the absorption becomes better. And I always, whenever I talk about Vaishnavi Trust or anytime I get an opportunity, I say, if you don't remember anything, I'm talking to the people who are not from Ayurveda background. If you don't remember anything what we spoke in the last 40 minutes, if you just remember one word, absorption, and we have done our job. So Ayurveda and Siddha does magic of absorption. So we've seen benefit in pregnant women to deal with pitta issues, and which helps them get healthier babies, babies of higher weight, the mother's hemoglobin go up. Feel free to edit, correct, ma'am.
Yeah, that's very true, and I'm blessed to be connected to Vaishnavi Trust, trying to help these individuals. And as Mohan sir is, rightly using some of the Ayurveda terms, definitely wherever again when we talk about Ayurveda, we talk about Agni, we talk about metabolism. So we don't try to fix symptoms; we work on the cause, and most major of the problem starts with the gut. So when we start working on the gut metabolism, on the Agni, and when we enhance the metabolism, absorption enhances, assimilation enhances, and then the overall system starts working better.
Thank you. Maybe the last minute or any last minute questions, uh, feel free to ask. And again, this is a vibrant community in whichever channel you came through. Continue to ask questions there. How do you get a copy of the recording? We will definitely send the copy of the recording. We'll go through the basic edits, and we will share in whichever forum you were part of. Definitely, this is made for promoting Vaishnavi Trust. So this has been my dream, because whatever 10, 11 years I've been benefited from Ayurveda and Siddha, I really wish many more. And of course, we see it on the roads. The number of Ayurveda clinics in every city we see is increasing. People have seen the benefit, and especially I lived in London for 4 years. I've seen because of the constraint in the government system, the scale is an issue. People have started, so it's kind of forced self-help, preventive health. So you see a lot of clinics coming up in London as well. People are trying to learn these things now. Of course, with technology and AI, I know a lot of these things are available at your fingertips. Feel free to suggest topics for our discussion. There are many ideas we are very fortunate to be associated with. We will bring the right topics of interest to all of you. Thank you all for taking time no, to join us and support our journey. And we will keep you all updated about our next plans. Any last minute thoughts you want to share, Dr. Sangeeta?
Thank you so much for giving this wonderful opportunity. And I've seen some questions in the chat. Someone was asking, was Dr. Vasant Lad provides these. So again, I say, reach out to the experts. Dr. Vasant Lad is an, eminent personality, and if you are in that area, try to reach out to them, talk to them about your situation, discuss with them, and whatever is fit for you, try to take it. So, see, when it comes to the Western population, I strongly emphasize that try to reach out to the experts, take the proper guidance, and then deep dive into Panchakarma. Even when it comes to India, also reach out to the proper channels, proper places. In Bangalore, someone was asking what is the place. If you don't know anything, reach out to Bangalore Ayurvedic Medical College. That's the best place. So all the Ayurveda, government Ayurveda institutes around the country, we have hundreds of Ayurveda institutes, and they do wonderful job. Every institute will have a Panchakarmas department. Reach out to them, express yourself that at what level you want to, you know. work on your body. You're having a problem, a disease, that would be taken care of. If you want to work on the prevention modality, that will be taken care of. So all the cities in the country have good Ayurveda medical colleges. Reach out to them. They have Panchakarma centers.
One
Thank you
interesting
so much.
question. So, if I were to understand, like say US, which Ayush system is there? How does someone start in the respective country? Is there a US Ayush governance board, anything like that, or US Ayurveda governance?
Not
How do
yet
you
in
some?
US.
Uh-huh.
In US, yet we Ayush Ministry has like we don't have, but definitely in many parts of the world, Ayush Ministry is having MOUs, and I'm very happy to share that recently I saw a news that even the European countries are signing in MOU with Ayush Ministry and they're introducing BMS courses. Recently in Malaysia, they have started Ayurveda graduation course with collaboration with Ayush Ministry. So I would suggest you all go to Ayush Ministry website and see how much it is extending. And now we will have a very big World Health WHO summit is happening in India in December 17th to 19th in New Delhi, and Ayush Ministry is, taking the lead, and we
Yeah,
are hosting
Ayush
it.
website is a good place to start.
Yeah,
And
Ayush website is a
Maharishi
good place.
International University also will give some information on what is allowed, what is available, at least in MIU.
Yeah,
Uh,
in our university, we do provide, we have undergrad courses, we have master's courses. For our medical doctors, we have fellowship courses. So you can log into MIU website and look into the details.
would you be able to comment on Siddha, Unani, homeopathy, and naturopathy? Will it be available in the Ayush Central website?
I think so. I think so.
Okay, thank you all. Thank you, Dr. Sangeeta Sharma, and thank you all for joining and supporting us in our journey. Wish you all the best.
Thank you. Thank you for giving this opportunity.